I mean, come on. Rhyming damn with 7 a.m. It's so good. It's so good. Hey friends, welcome back to the Be Well Baby podcast. This coming weekend is December 13th, and that is Taylor Swift's 36th birthday. And I decided that was reason enough to dedicate an entire episode to her. And it's not just because I listen to her pretty much every day with my 7-year-old and practice explaining concepts like heartbreak and lust in an age-appropriate way in the car. And it's not just because I still cry every time I hear the key change in Love Story. And it's not just because I deeply honor and respect Taylor Swift as a musician, as an artist, as a lyricist, as a performer. I mean, come on. Rhyming damn with 7 a.m. It's so good. It's so good. So there's my fangirl moment for the episode. Just a quick little loving note before we dive in. Everything that I share on this podcast is for educational and informational purposes only. It's not medical advice. It's not meant to replace care from your own healthcare provider. Every body, every pregnancy, every postpartum season is different, and you deserve support that's personalized to you. By listening, you agree to take full responsibility for your own health decisions, and neither I nor my amazing team can be held liable for how this information is used. If something you hear sparks questions or concerns, or you want to reach out to my team, we would love to talk to you. Otherwise, reach out to your own healthcare provider because they probably would also love to talk to you. Okay, that's the grown-up stuff. Let's get into today's episode. But here's what I can see. As a bystander who doesn't pay much attention to tabloids and is maybe 2 degrees separated from Taylor, maybe less. If you know her, please share this episode with her. Here's what it looks like to me from my perspective, just based on my experience of being a consumer of what she creates. Taylor seems like she is deeply committed to becoming the best version of herself. She reinvents, she reflects, she grows, she rests, she studies. She shows up differently and unapologetically herself in each era. And here's something that really inspired me. She trained for the Eras tour by running miles and miles on a treadmill while singing her full set list. She wasn't walking, not lightly jogging, not marking. She was running while singing at full voice. That is dedication, that is focus, that is practice, and that is driving herself to be the very best version of herself. And everywhere you turn, you see that she is doing this for her fans. So there's no shortcuts. There's no excuses. There's preparation and excellence. And honestly, I have a similar drive. Not really comparing myself to Taylor Swift here, guys. I'm not, I promise. But I do, to work, to preparing, to showing up fully for my people with all of the knowledge that I can possibly give. And that tells me everything I need to know about her potential approach to motherhood. She wouldn't wing it. She would not just hope for the best. She would prepare, she would learn, and she would meet it with the same energy and dedication that she brings to everything else she does. Because pregnancy, birth, postpartum, and parenting a newborn, it's a short season, but it requires the same kind of drive, focus, and commitment to excellence that her Eras tour demanded. Maybe even more. And that is exactly why I wanted to imagine what supporting her through this would be like, and why I want to talk about this for all of you listening too. We are talking about the most intense personal growth initiation most people will ever experience. And here's the problem. So many people, brilliant, dedicated, capable people, walk into pregnancy completely blindsided by the physical symptoms, the emotional shifts, by the nervous system changes, the sheer amount of learning that it takes. No one tells you that this is like enrolling in medical school, biomechanics school, hormone school, lactation school, baby school, and emotional resilience training simultaneously while nauseous, right? So today I'm walking you through exactly how I would support Taylor Swift. Body, baby, mind, hormones, nervous system, feeding, all of it, so that she does not get blindsided by this rite of passage because it truly is a rite of passage. And it's one of the only ones that we still have in our society. And honestly, this is what I want for all of you. From here on, I'm talking directly to Taylor. But if you fall into a similar category, imagine that I'm talking to you. First of all, babe, you are now officially advanced maternal age. So welcome to the club. One of the things you might hear is that over 35, you have a geriatric pregnancy. And if you haven't heard that term before, I'm sorry to be the one to break it to you. It sucks. It's not fair that that's what it's called. And so many of us are choosing to have babies later in life. And yes, biology is biology. It still matters, the medical terminology notwithstanding. What being advanced maternal age actually means for you is this. You are more likely to be monitored closely. You are more likely to be labeled high risk. And you're more likely to have your experience framed through fear instead of power. And that's where I come in. I guess you're probably curious what my background is because you haven't gotten to know me yet. This may be the first episode of the Be Well Baby podcast that you're ever listening to, Taylor. So I'm going to tell you about myself, but I'll try to keep it brief. I am a doctor of physical therapy with a narrow scope of expertise. I treat birthing bodies and their babies. Yes, I do pelvic floor work when it's needed. And I started my career as a yoga teacher for pregnancy and postpartum, and then a massage therapist. So a lot of the shapes and cues and precision I have as a physical therapist and the nervous system angle that I bring come from that background. I'm also a continuing education provider and professor for the fields that I'm licensed in. I teach other PTs about massage, and I teach PTs, OTs, and lactation consultants about infant development and infant massage. I'm also known as a baby whisperer. I have my own approach to how I gain consent from an infant. And infant massage might be what I'm most known for because I started the massage program in my neonatal ICU where I worked for years. I fought for years to get massage oil so that we could do this. In our NICU, we were actually told that we had to use Vaseline. You're not supposed to do that. And as a certified neonatal therapist and certified trauma-informed professional, I am deeply, deeply passionate about helping people understand their baby's cues and meet their baby's needs while also tending to their own needs. And of course, I want people to feel prepared for a NICU stay, even if they never set foot there, because there is no reason not to have a little background. It's not about fear, it's about preparation. And if you're prepared and you never end up in the NICU, maybe your best friend does, and then you can help. So I wanted to keep this short. So I will just say also, I became an international board certified lactation consultant because I was treating the mom and the baby so much. And breast or chest feeding was always, always, always part of the problem. And I was finding that babies who had a harder time feeding at the body were also the babies of birthing people who had the hardest time with their mental health. So I knew that if more of our babies in the NICU could have been getting all the benefits from breastfeeding, then the world would be a better place. And they weren't. So that's all to say. I come to this as a doctor of physical therapy, a lactation consultant, body worker, yoga teacher, birth educator, and I specialize in approximately 2 years of your life if you count preconception, pregnancy, up till that baby is walking. And after that, I send you on your way to amazing experts who can help you if you need it. But that season is so particular that generally, if you are addressing things as they come or even before they become issues, they're not that big of an issue. So my wheelhouse is prevention, optimization, and helping you thrive in this incredibly transformative time. I know it's a narrow range of genius, but it is where I am most comfortable. So enough about me. Let's talk about what we would do. Taylor, you probably already have one of these, but if you don't, I wanted to tell you all about the Aura Ring. I started using it postpartum with my second baby so that I could actually see how poor my sleep quality was. And watching the subtle shifts over time has been incredible. It tracks your heart rate variability, your sleep, your recovery, even the little changes in your body temperature before you notice them. It was really amazing to see my stats change throughout my third pregnancy and then watch them improve postpartum. One of my favorite things, it actually gives me permission to rest. And as someone who struggles to rest, that is everything. It really points me to recovery in a way that nothing else does. You can click the link in the show notes for 10% off your Oura Ring, or if you already have one, grab one for your bestie or your mom for the holidays. They deserve rest too. Okay, back to the show. Taylor, you are an athlete. Anyone that trains at such an elite level is an athlete. So we would really need to look at your body mechanics, your pelvic floor, your posture, your compensation patterns, because there are things that you can do prenatally or even preconception to help your body be an amazingly open and free place for a baby to grow. And I have to tell you this very challenging truth. You will lose your glutes. And I know that you think you won't because you'll train and you'll keep strengthening, but it doesn't matter. Your center of gravity will shift and your adductors will be tighter than they already are. Your obliques will tighten and your rectus, the front of your abs, will have to stretch. So there is so much that we can do right now in early pregnancy or even pre-pregnancy to bring awareness to this. We would also work on your pelvic floor baseline, figuring out what is going on, and we would prepare your core to be able to lengthen and strengthen against that lengthening. We would work on hip mobility so that as relaxin, this hormone that is making you looser and looser throughout your pregnancy, is taking over, that you don't end up with imbalances that cause pain. And we would talk about your nervous system and setting expectations. We would make sure that you are strengthening your body in a way that supports going on tour if that's what you're doing, performing if that's what you're doing, especially with your rib cage. Just being a singer, you understand how to breathe in a very specific way, and you use it as a tool. So your rib cage and your entire body could change shape, and understanding what your diaphragm is doing is going to be key to making sure that it doesn't really impact you. And those pregnancy symptoms like fatigue, nausea, pelvic pressure, back pain, any pain in your body, they don't come from nowhere. They come from a nervous system and a body that were not taught what they were about to do. And this is where people get wrecked emotionally because they wonder, why didn't anybody tell me that it would feel like this? And why does my body feel so foreign? And why am I crying at a banana? And it's not because something is wrong. It's because pregnancy is a total neurohormonal reorganization. Taylor, I know you want to understand all this, and that is why I'm telling you. And here's the thing. Pregnancy is not just physical. It's not just about these physical symptoms. It is cognitive overload. Suddenly, you are learning all of these different things: anatomy, medical language, rules for what you can and can't put in your body, or the way that you move your body, new risks that you didn't even know existed. And it can be really overwhelming. And you can always have this like wondering, does this apply to me in my particular situation? And that's where I can help. You will also end up with new instincts. And just by saying out loud, yes, I want kids, we want kids, your brain has already started changing. If you want to know more about that, you can listen to episode 2 with Barb Buckner Suarez. But people are shocked by how much there is to know about this and how your brain and your identity have already started to shift before you even become pregnant. And I know that you are the type of person who studies. I know you don't want to wing this. So we would talk about your birth choices. And I will tell you right now, I am all about sharing the evidence, but I do not think it's useful for me to have an idea of what's best for your body. It is my job to tell you everything I know, all the experience that I have. That's my job. And it's your job to go inside, to go internal. I know you're really good at this already, and really get a sense of what feels right. I know you can do that. And some people have this misconception that if you learn too much or if you learn a ton, you'll feel like you have more control than you actually do. And I suppose that can be true, but if we worked together, I would remind you all the time that the only thing we know for sure is that we have no idea what is going to happen. And your doctors have no way to predict how your birth is going to go. Statistics don't tell you anything about your particular situation. That is left up to the magic. It really is. And at the same time, that does not mean there isn't room to optimize your body and your mind and your spirit for this incredible transformation. That is something that you absolutely can do now. Okay, back to what we would talk about. We would go over induction versus spontaneous labor. We would go over a vaginal delivery versus a cesarean. We would talk about a cesarean, even if that's not your plan, because you never know. You never know. And there are so many ways to reframe your life experience to see it as something powerful and beautiful and meaningful, even if that wasn't the plan. And honestly, just listening to your lyrics, you're so good at this already. Pain coping, we would talk about pain and how you might decide to work with the sensations of labor. We would talk about hospital systems. We would talk about your plan for feeding your baby and maybe for pumping, and especially your plan for returning to work. I have to tell you very honestly that postpartum, that incredible, challenging, leaking from everywhere time can be one of the most beautiful, profound times where you are falling in love with this tiny human and falling in love with Travis Kelce all over again. It's amazing. And it can also be one of the most creative times in your life. So in postpartum, I would encourage you to write and create and not feel any sort of shoulds around how you spend your time. You can spend your time doing exactly what feels right. And please don't push yourself, because I really desperately want to protect your pelvic floor so that you're not peeing yourself when you're 70 and not telling anyone. That's a big deal. You should be telling someone. And if you're peeing yourself now, you should tell me. And we would talk about all of those things before you're super sleep deprived and weepy. The beauty of hanging out with me throughout your entire pregnancy is that by the time you get weepy, we can just cry together because I know you, I've seen you, and I can hold that space and tell you to look at how far you've come and that I've been there and hundreds of other badass women I know have been there, and you can do this. Okay, if you are postpartum right now and you really needed to hear that, you can do this. You can do this. Taylor, I would also want to talk to you about the part where desire doesn't come back on a timeline, and nothing about that means that there is something wrong with you or your relationship. We would actually have a conversation, the three of us, about sex after birth before the birth. And it makes everything easier, and it actually increases your intimacy in a way that you could have never imagined. We will also talk about what happens when your birth doesn't look like the version that you imagined, and how to grieve that without shame, because grief is okay. And it's something that we all move through in different seasons of our life. And if this is one of them, then I'll walk with you through it. We'll also talk about your postpartum mental health, not just sadness, but the anxiety, OCD, rage, intrusive thoughts, and how common all of that actually is. And we talk about the stuff that nobody glamorizes: hemorrhoids, scar pain, prolapse symptoms, constipation, all of it. So nothing feels like a personal failure. We'll prepare for the possibility that feeding might not go the way you hope, and how to make those pivots with no shame. And we'll design who's going to protect you, who runs interference, who feeds you, who makes sure that you are not the last priority. Although I'm sure that would never happen to you. Okay. In postpartum, you should feel so held, not desperate for answers in the middle of the night. And of course, I would be your lactation consultant too, obviously. We would give you and Travis all the education about feeding your baby and make a plan for when baby arrives. I would definitely size you prenatally for flanges if you plan to breastfeed at all, and teach you how pumping is supposed to feel, because most people don't know that it should not be uncomfortable. And we would practice all of these things, collecting colostrum, all of the things that you need to know before your baby comes. We would also create a realistic feeding plan for your life, because it has to fit your life, not perfectionism. Lots of people think about chest feeding, my body should be able to do this, so I'll just figure it out when the baby comes. Maybe I'll watch a couple videos on how to latch a baby. No. You will be bleeding, you will be swollen, you will be leaking, you will be emotional and overwhelmed. And it doesn't matter that you're Taylor Swift, all of these things will happen to you too. And you will suddenly be expected to master a skill and a mechanical device that attaches to your nipples. That is not the moment for first learning. And Taylor, like all dedicated planners, I know that you would want confidence, not chaos. So my parents were musicians with the San Francisco Opera. And I grew up with auditions and being on stage in operas myself, and eventually went on to sing in a punk rock band. I played the bass, and then a jazz band. I played the accordion. And here's what I know about performing and performers. We live in our nervous systems. Taylor, if your baby ever needs a pacifier, and not all babies do, the one that I would want in your world is the Ninny. It's the only pacifier designed to actually mimic the shape and function of the breast. It's very soft here, like an areola, and then harder, like a nipple. And this shape means that it supports healthy oral development instead of interfering with it. I really love it because babies don't just passively hold it in their mouth like the ones with the bulb on the end. They have to actively suck. It's hard work. It's my workout pacifier. And that matters for feeding, for regulation, and for long-term oral function. It's especially beautiful for breastfed babies who need a little extra soothing without confusion. If you're listening and you're pregnant, postpartum, or buying for someone you love, you can grab a Ninny through the link in the show notes or use the code BeWellBaby for 10% off at checkout. It's one of these tiny little tools that makes a huge difference. And my favorite part about it is that babies don't get dependent on it. All right, let's get back to the show. So birth prep for you would not just be learning all the things you need to know about birth, not just understanding the anatomy or your pelvic floor, not just birth positions. And yes, all of those things we will absolutely talk about. We will absolutely go over. We will definitely make Trav practice all the ways he will support you in your birth, hands-on, but it will also be regulation, breath, and like using the tools that you already have and honing them for this specific event. And it will be safety and agency and advocacy. Because birth doesn't only happen to your cervix. It happens to your entire body, your mind, and it happens to your identity. So we would prepare for the unpredictability. We would prepare for the intensity. We would prepare for the emotional opening. We would prepare for, I'm already crying. We would prepare for the surrender that even the most controlled humans must face. Because that surrender is what gets you through birth without trauma. And we would build in room for, I didn't expect it to be this way, and I still think I am the most powerful freaking badass in the whole world, and I'm still okay. Okay, let's talk postpartum, because this is really where those dedicated, high-performing people suffer the most. Because the world says, snap back, get your six-pack abs on, get back to work, be productive, be a productive member of society. And yet, your brain has been rewired to feed this human with your body, So even if that's not what you decided to do, your brain is like, you have to feed this baby. I just built and birthed a human baby, and all I need to do is focus on that. Our physical sessions would definitely address pelvic floor recovery and core reintegration. We would work together and with your team, because I know you have a team, to determine when you are actually ready for more physical load and challenge. Because as somebody who also loves to move my body, I know that there's this like itch to start moving. And so you want to make sure that you are safe, but B, also be meeting your body where you're at and getting to know her, because she's a new body now. And you have to ask her, who is she? Who are you, my new friend? And how can I support you? So we would get to know her. And then we would also talk about nervous system support and how you and Travis are balancing the load of everything having to do with protecting your sleep and caring for and loving this new sweet baby. We would also talk about protecting your milk supply if you choose to body feed. And of course, we would talk about your actual baby, because at the end of all this, there is a tiny human who needs you to learn really quickly what their cues are, how to feed them, how to gain consent from them for touch. We would even learn infant massage, and we would talk about how to know if your baby is getting enough food, how to change your baby's diaper, how to bathe them in a way that doesn't stress them out. It's really not as straightforward as you might think. And we would talk about how to soothe your baby when they are losing their shit. Finally, we would go over this emotional containment and preparing your incredible relationship for the biggest toll it might ever have on it: parenthood. I'll also be the one to remind you to rest. Like I said before, you are saving your organs and your pelvic floor for later in life, not racing back to strength right now. That is more important than being back on stage immediately. And you can get on stage, just sit there, enjoy it. Sing if it feels good, but don't do things that don't feel right. And the wise women in my life are constantly reminding me, at our age, we have so much time. It doesn't feel like it, but we do. Postpartum is not a performance. It's a recovery. And you deserve to have everyone around you understand that and protect that. And no one should be blindsided by that fact. Here's what I actually believe with my entire being. Taylor, it seems like you are obsessed with becoming more regulated, more honest, more grounded, more yourself in every season of your life. And that tells me that you would never run from the discomfort of not knowing, from the identity shift. Like, what an incredible season to start writing music about. The vulnerability, the learning curve. You would meet all of that with curiosity. And that truly is the secret to not being wrecked by pregnancy and postpartum. It's the curiosity, not avoiding the change, but preparing for it. And I also know this. Taylor, you are such an advocate. You use your platform for good in so many ways. And if you knew that this level of care existed, you would advocate for every birthing person to have this type of support, for every infant to have parents that understand them, and for breastfeeding people everywhere to hear that pain is not something you just have to live with, and for Black and brown people to get better birth education and breastfeeding education so that they can stop dying in hospitals. It is wild if we look at those statistics. So Taylor, if you're listening, I have a flange kit, I have a pelvic floor plan, a nervous system strategy, a postpartum recovery roadmap, baby education, all of it with your name on it. Just text me at 971-351-2714, and I promise I can help you. And for the rest of you listening, if you don't want to be blindsided by pregnancy, birth, or postpartum, it's why I do what I do. And just the other day, I was on the phone with a friend who was told that her baby might have to come a little bit early due to a medical concern. Up till now, everything had been really standard in her pregnancy. She just had that advanced maternal age label. And right then, towards the end of her pregnancy, we were able to talk through everything that she needed to think about with this new diagnosis, all of the different possibilities, the idea that she might be in the NICU. It's not the end of the world. And I was able to prepare her right then for the possibility that her baby might end up having a difficult time breastfeeding. And that is a goal of hers. So we talked through all the things that she can do right now to make that transition so smooth. Sometimes it's hard to remember, especially if you've been given a diagnosis. If you were just told that you have preeclampsia and you got to get induced right now, it's so hard to remember that on the other side of this super, super scary thing where you're just worried about if you're going to survive, if your baby's going to survive, you don't really get to rest on the other side. There's a baby there that has needs and might get separated from you, and that's important to address. But to even be thinking about the possibility of your baby being in the NICU is so, so scary. And it's something that I really love to prepare my clients for, because we can just never, ever predict what is going to happen. It could be anything, and it could all be textbook, the scariest possible things, and still feel beautiful and supported. And that's why birth is so beautiful, and the unpredictability is so beautiful, and it's why it deserves reverence and respect and awe. And it's why education is so important. You deserve to meet this season prepared, Taylor. Not scared, not alone, not hiding with your head in the sand like an ostrich, not guessing, but confident and open and easy and loving and excited. You deserve joy. So, happy birthday, Taylor. I hope it's an incredible one, and happy becoming, everyone. Thanks for listening, everyone. Thanks for tolerating my fangirl moments, Taylor, if you're still listening. And for the end of this episode, I'm going to read a email that I got from a client who really loves the podcast. And I'm so excited to be able to share all of your kind words, and I just can't wait to see where this goes. So, loving the podcast, Megan says. You have jumped directly into excellent status as I see it. I'm 21 and a half months postpartum with my first, following a challenging birth experience and a challenging breastfeeding experience. Though still breastfeeding and going strong. Oh, that's amazing. I am also still breastfeeding my 2-year-old, and it's really fun. It's fun to breastfeed someone who's talking. I never thought I would do it, and here I am. And it's really sweet. It's really sweet. One of my favorite things that she says is, other side. I'm all done. Other side. She says, I still have daily thoughts about my postpartum experience as I process things, and finally have small spaces for revelations in my small amounts of time to think. Because after that baby comes, there is not a lot of time to think. That is so true. And it seems every time I have a new line of thought, there you are on the topic in your podcast. It's uncanny, and it's been incredibly helpful. I'm so happy, Megan. I'm so glad that I could be there for you in this time, in your ear, and talking about what you're thinking about, because I'm obviously thinking about it too. And so many of us are. She says, thank you for putting all this out there and putting it together. I'm enjoying it so much. Thank you so much, Megan. And if you want your little email read on my podcast, I will 1000% do that for you. So that's all for today. I'll see you all next week on the Be Well Baby podcast. I'm Emily, and I can't wait to talk to you again. New episodes drop every Wednesday, and you can find us wherever you get your podcasts. Follow me on Instagram at BeWellBabyPDX, or just visit BeWellBaby.org. Send an episode to someone who's pregnant, postpartum, or just needs guidance. No one should have to do this alone. Welcome to the Be Well Baby podcast. You're in the right place.